prior to being a student nurse, what did you do? What were you doing before going to uni?
Okay, well, I was a carer for a few years. I'd been out of education for so long, so I had to go back and do my access course
Yeah.
at college, which was a very, very intense course. And the process was the interviews is really nerve-wracking. It
Yeah.
really is. But I mean, what I learned from it is just be yourself.
Hi guys. Today I've got a special guest with me. For some reason, I've always wanted to talk to a student nurse, somebody who's still along the journey to becoming a registered nurse. And today I've got a student nurse, Agogo, and she'll be sharing a student nursing journey with us, how she got to university, what placement is like, and so on and so forth. So, hello, Agogo, how are you doing today?
I'm fine, thanks. Yourself?
I'm doing great. Thank you. Thanks for coming on board. Thanks for coming to the channel.
No worries. Thanks for having me.
Right. So I just wanted to speak to you about your journey as a student nurse. And I just wanted to find out prior to being a student nurse, what did you do? What were you doing before going to uni?
Okay, well, I was a carer for a few years,
Yeah.
um, to my husband, who unfortunately he died in 2019. I was also a mother, so I had those two things going on. So yeah, I mean, after his passing, I just said, you know what, yeah, I need to just pursue my dream to
And
becoming a
that's and
nurse.
that's a really good why. A lot of us
Mm,
as nurses, we have our whys.
mhm,
Why,
mhm.
and that's a really good why for you. That's
It
really good.
is.
I mean, one of the things I've done on my channel is to talk about, the importance of working as a carer before going into the university to be a student nurse.
Yeah.
For you personally, how did that speed up? How did that help your university application process and also your student process? The fact that you've got a carer experience.
Well, I mean, it didn't really, I wouldn't say it kind of boosted my application in any way because even in my interview, I was not asked those questions really. I think they want to see that you're passionate
Yeah.
and that you love people. So I think they saw those two things, and I think that's how I kind of, started my journey. So yeah.
That's really good. And I think from there it takes me to the next question of what were some of the interview questions? How was the process of getting a place at the university?
Okay. Well, for me, I'd been out of education for so long, so I had to go back and do my access course
Yeah.
at college, which was a very, very intense course. I had to have my English and my maths at A to C. But actually, when I was leaving, they had to change the criteria, and they said you had to also have science as well. So I think they're making it a bit more. I won't say difficult, but the thing is, it's really science based. So
Yeah.
I think a lot of the students in my class struggled a little bit with that. So I think they kind of said you've got to have at least A to C in science. And if that criteria had been there, I wouldn't have got in because I got a D for GCSE. So yeah, so I did that, and then you go through the whole Ucas process. You get help from your teachers at college. And then yeah, you just pick the universities you want. I think it's between 4 to 5 universities that you pick, and because when I did mine, it was kind of like say during the COVID kind of time. So my interviews were online.
Yeah.
So some of the questions I had, they asked questions about, the NMC code. So I
Yeah.
always say to people, at least know that and understand what it is, really understand each element of it. Um, so yeah, I think one of the questions like, what's the most important aspect of the NMC code that's important to me? And they also asked about the 6 C's as
Yeah.
well.
I was
So
thinking about that.
yeah,
Yeah.
yeah, those 6 C's. So if you know those two things and just be yourself. Don't try and pretend to be somebody else. Just be yourself, but have an understanding of these things because it shows that you've done your research and you can have an idea of what is expected of you as a nurse.
Mm.
So yeah. So I mean, the interviews is really nerve-wracking. It
Yeah.
really is. But I mean, what I learned from it is just be yourself, and that's it.
That's
Don't make up stories. Just be yourself. If you don't because I remember actually the university I got into, she asked me a question and I didn't quite understand, but I said to her, okay, could you please repeat that to me, please? So don't just try and waffle on. Just be honest and just be open and just be cool. So
Mm.
so yeah, I think yeah. So that's just the advice I would give in terms of interviews. So
That's
yeah,
really good. And what university are you studying at the minute?
I'm at King's College
King's
London.
College in London.
Yeah.
Okay, that's really good.
Yeah.
And did you feel like the access to nursing course prepared you for
Oh,
the
you know
interview?
what? You know, the students that are struggling the most in the class is the ones that just come out of school
Yeah.
or have maybe had a gap in their education. But the ones that are really excelling is the ones that have done access course, because the bioscience in the first year is so intense. It's like they already expect you to have a certain level of foundation. So honestly, without that, honestly, I think I would just be, yeah, I'm happy. I would say take out that year, do your access course, take your time, don't rush it, and then go into it, because it makes things so much easier, honestly.
That's
So yeah,
that's really good. And obviously the math, the English, the science
yeah, yeah,
prepares you for the anatomy and physiology, the numeracy test, and
yeah,
all of that sort of thing that you
yeah.
do at uni. So I believe you're in first year or
Yeah, I'm
second
in
year?
my first year, yeah. So I'm going into my
Yeah.
second year in September.
Okay. And
Mhm.
have you guys started any placements just yet?
Yeah, so I've done two placements in my first year. So my university, they gave us a choice of going through the community pathway. So
Yeah.
what that means is we will have more of experience in the community.
Yeah.
So I chose that because of my experience of, caring for my husband. I kind of understood what nurses did in the community, and I wanted to kind of have a bit more of an understanding.
Mhm.
But we obviously still have to meet the NMC criteria and have placements in the acute setting and hospitals and all that. But so far, both my the thing is, both one of my placements was in the ward and one of my placements was with the district nurses. However, the one in the ward was still classified as community. It's they called it rehabilitation bedded unit.
Yeah.
So it was still. I mean, I would say I still got a ward experience, but the patients they're not acutely ill, if
Yeah.
that makes sense. You're just trying to get them back to their baseline so that
Yeah.
they can get home. So so yeah, I
Yeah.
mean, for the district nurses, it was really quiet, really quiet. A lot of, I would say, a lot of insulins. So basically,
Yeah.
diabetes and
Yeah.
wound care. You kind of become an expert in that.
You
That's
do.
all you do
Yeah.
every day. Yeah. Um, and then I wanted something a bit different, so I asked to, because they were in a health center. I asked to stay there in the ulcer clinic, which was
Okay.
interesting, very
Really good.
interesting. Yeah. So yeah, I wanted to have time with the diabetic nurse, but she was busy. I wanted to spend time with GP, but again, they were quite busy, so I didn't get the opportunity.
And I think it's very important to try and take advantage of those
Yeah,
services and those facilities that are
yeah,
around, and
yeah.
also so that you can actually get a round view of being a nurse. I mean, obviously, from what you're saying, I know that you're studying to be an adult nurse, a
Yeah.
general nurse. And has there been any element of mental health, learning disability along the way in your journey as a student?
Um, I don't know. The thing is, I don't have experience in that, or I've never kind of. I mean, I don't have, like, for example, sometimes when people go into mental health, maybe they've had a family member in their house who's maybe had mental health, or they've come in contact with that. But for me, I'm not too sure how. I've not experienced this, so my mind's not closed to it.
Yeah,
But I chose adult nursing because I thought to myself, that's kind of, it will give me the opportunity to branch off to other nursing aspects if I want. So that's why I kind of chose it. But mental health is a thing. I think it's important, even if you're
yeah,
just an adult nurse, to have an understanding of the mental side, because every patient that comes in, some of them have some mental issues there. So you've got to be able to communicate well with patients. So so yeah, I mean, I wouldn't mind. I mean, if I was given a placement, I'm quite open minded, let's just say.
that's really good.
Yeah.
And have you, I believe that you guys have done a few assignments in first year. How have you
Yeah, we
seen
are.
that? And what
Yeah.
are some of the complexities that come with the assignments, and what should people be looking out for?
Yeah, so the thing is, unfortunately, my access course, we didn't really get a chance to do essay writing. So when the essay writing came in, it was, how would I say, it's different. It's very different because you got to do referencing,
Yeah,
you got to do your research. You got to
Yeah.
do. I mean, for first year, they talk about critical writing, but they're a bit lenient on you. So if you do descriptive writing, they're okay.
Yeah.
But when it comes second year, you have to do a bit more critical writing. So I mean, it was interesting. I mean, I did really well. I did really really well. So maybe I just kind of underestimated myself. But looking at it now, it's not difficult. It's not tricky to write
Yeah.
essays, and most of the people that failed their essays because they did what they wanted to do.
Yeah.
If
Yeah.
you look
They,
at
they
if you,
didn't follow the
yeah,
instructions
yeah,
clearly.
just give them what they want. It's not about what you want. Just give them what they want. Just have a simple structure. Because even before I did my essay, I went to like a workshop, and they said the first thing is just make sure that the layout looks good. Already, the person who's marking is feeling good, feeling happy. Oh, okay, this person is aware of presentation. That already you start off on a good start. But if your work is all over the place and things like that, so yeah. But
Yeah.
I'd say to students, talk to the librarians, talk to second years, and yeah, make the most of, because we had a chance to do formatives.
Yeah.
So once we did formatives, we got feedback, which really really helped.
Yeah.
So
So,
yeah,
the flow, the flair in your writing is very
yeah,
important. And
yeah,
I think personally, one of the videos I've done on my channel is how I ranked first class in my
yeah.
nursing degree. And there are three key things that are very important. Number one, referencing.
Mm,
Make sure you get full grades in referencing. That's one of the things that I say. Things like using italics, underlining, establishing if you are referencing a book, a journal, a website. Those are very important. And secondly, what I say is that try and also get as much marks as you can get in placement. And also, thirdly, have a good flow, have a good relationship with your mentors, your lecturers, your course lead. I think those are very important factors within the nursing school. So,
mhm.
what's some of the challenges that you faced while you're studying? What are some of the challenges within your first year?
I think juggling it, because I'm also a mother,
Yeah,
and being a student, it's really it's a challenge. It's really a challenge. So yeah, I think that's one of the parts I found difficult. And also the first 2 months of uni, you just feel like you're just everything. So much information is being thrown at you that you're just like, what is information overload? But
yeah,
by the time after your exams in January, everything kind of comes together,
yeah,
if that makes sense. So yeah, my key is just being organized. That is
yeah,
really, I have to be organized to the team, and always
yeah.
reaching out when I need help.
That's really good. I mean, one
Yeah.
of the videos I've got on my channel is about why nursing has a high dropout rate. And from what
Mm,
you said, family balance, I mean, university and family
yeah.
balance is very, very
Yeah.
important. Um,
Hmm.
you spoke about the library and the role and the importance of having going in and using the access of the librarian. How important is that for people who are looking to study nursing? How important is it?
Yeah, I think it's really good because one, they can give you tips on how to research,
Yeah,
certain signs to use, certain abbreviations to use, and also they can help you as in just how to use the system really.
yeah,
And in my uni, we kind of have a service where you can book an appointment with a PhD student. So
yeah.
apart from the librarians, there are other services in the library that you can use. So they give you a bit of advice on, writing, and you can even just show them like a snippet of your work, and they can give you feedback with that. So I think, and the librarians, I mean, they've been there for years, and they've seen students come in, come out. They've seen why students haven't done so well, why students have done well. So you can ask them all these kind of questions.
Yeah,
So yeah, that's
that's
what.
that's really that's really good. So thanks a lot for coming onto my
No
channel to share
worries.
your story with me, and good luck with second and third year.
Thank you very much. Thanks for having me.